Well, welcome to the Postal Health Career. It's Dr. John McCormick here at the Ovation Studios. And it's been a little while since we've done our last podcast, and be today. So I'm gonna jump in. We're gonna talk a little bit about where the ACA market, that's the Affordable Care Act marketplace, is going to. All right, and pulled a couple articles, and those are kind of things that kind of make my brain start thinking. I don't know if you're aware or not, if you're not out in the marketplace, many of the tax credits and subsidies were rolled back here in 2026. That has had a significant impact on the marketplace, although several of the carriers are reporting that they've had stable enrollment. Some carriers have lost significant enrollment, so much for in fact that in some states, some of the major carriers like State MU 9 are actually pulling completely out of the marketplace. Well, of course, that's going to create gaps, right? Because if there's no other carrier in that market, that means that we're going to create a whole bunch of people that are underinsured or uninsured completely. They were relying on those other plans that have now withdrawn from the market. The other component of that is because some of that tax money, subsidy money has been removed, that means that people are not getting the same amount of subsidy as they would have had previously for plans and are subsequently changing the plan choices. So people that were on what we would call a platinum level plan or a gold level plan, which are kind of the top two, are now gravitating towards those bronze level plans, which means they're going to have a higher deductible, higher out-of-pocket cost, in some cases higher co-payments, and in some cases less coverage. And the reason for that, obviously, is price point. And we've had a lot of discussions about that when we were forming Ovation Health and for a lot of years, we only offered a platinum plan, and that was very fizzle. Wow, whatever. It was very psychological for me, and it's something I felt deeply about. And even psychological is the wrong one. Something I felt really deeply about. Philosophical. They're very philosophical about, and that's because I didn't think that a health plan should be a contributing factor to health debt, and subsequently, in some cases, individuals that even had health insurance having to declare bankruptcy and do all those other things because of their plan design. It's not that they didn't have health insurance. It's their plan is designed in such a way that between their deductible and co-insurance and things like that, they might end up with a $10 or $15 or sometimes $20,000 bill, depending on the bronze level plan that they had. And the reality is that there's a whole segment of the population out there that can't afford that. You know, they don't have good credit. They're never going to have good credit. They're working in, minimum wage jobs or jobs that are just a little above minimum wage. They've stretched out to get the health insurance to begin with. And now they've got suddenly a $20,000 debt, and that's like buying a new car. And there's no payment terms, so they can work and negotiate prices and things like that. But ultimately, at the end of the day, especially if you have an ongoing medical condition, and this is where it gets really ugly, that transitions over planned periods. So in 2004, you might have incurred a $20,000 debt through deductible co-insurance, and now you're in 2005, and guess what? It starts all over again. And so if you have this ongoing condition or a flare-up of the condition, you can incur another $20,000 debt on the other side. So now you're at $40,000. So I know I did an initial podcast a long time ago about medical bankruptcy and things, and so I felt real strong about that. And what we're seeing now with the ACA marketplace is it looks like we're heading straight back down that path, all right? And if that isn't bad enough, all right, we were looking at insurance are proposing, the insurers that are in the ACA marketplace right now are
proposing a median, not the most, a median ACA rate hike of 15% for 2027. So they're already out past 26 and into 27, and they're already saying, we want at least 15%. And some carriers are saying that's not even going to be good enough. It has to be at least 25%. So when we look at, and we look at these kind of prices all the time, and we're seeing individual policies that are $1,200, $1,300, $1,400, bonds plans that are $800, $900, that with the 15 or 20% rate hike are going to go over $1,000 a month. Now we're moving into the realm of, if you don't qualify for a subsidy and you have a small business and you are relying on the ACA marketplace for insurance, that's going to become completely unaffordable, even at the bronze level. All right. And so, you hear these solutions, well, we'll use what's called an ICRA, where that's a different kind of coverage that an employer can engage in, where they set up a very compliant way to provide their employees funding, where the employee then can go out and make a choice of what kind of care they want to purchase with that money. Okay, so I'm an employer and I set up my compliant ICRA and I go, the most I can afford to keep my doors open to the business is $500. And then the employer takes that $500 and pivots over to the ACA because that's the only place they know that they can get coverage at an individual level. And they're looking down the throat of $1,000 or $1,200 for themselves. We're talking $2,500, $3,000 for a family, but for themselves, over $1,000 for individual care that has a deductible, that has co-insurance, that's maximum out of pocket. I think in 2027 is going to be somewhere in the neighborhood of $15,000 additionally. So you could have a deductible of $5,000, a co-insurance of 20% or 30% on a bronze level plan, and go and have them. So all in, you're $20,000 in the hole before, if you have any kind of major medical event. Folks, this isn't sustainable. This is not sustainable. And when they talk about the driving factors are the driving factor that, yes, insurance carriers, the major insurance carriers are making billions with the B dollars, like it, hate it, or what have you. All right. But the driving factors of this is increased cost and hospitalization that's exacerbated by consolidation. And we see it over and over again. Hospitals and insurance carriers working together, the carriers owning the hospitals owning the doctors, the carrier owning the pharmacy, or the pharmacy owning the hospital, the doctor, and the pharmacy. You would think in any other industry, consolidation would be a good thing. Advances in technology would be a good thing. It would drop prices down. All right. That's not the case in medical. What we're seeing is the more they consolidate, the more there's monopolies in particular municipalities and things like that, where hospitals don't have to negotiate rates. They don't come down. What we're seeing is insurance coverage at these hospitals is unaffordable. The smaller communities are being bankrupted by the systems that they rely on. And it's just not a sustainable solution. I wish in this short podcast I could sit here and say, hey, this is the way we ought to go. I think there's a lot of thought leaders in the industry that are working hard on different components of this. From the pharmacy side, whether it be Mark Cuban or the president trying to drive down rates that, back and previous. And the current president, Paul, working on that, trying to drive down the cost of pharmaceuticals. That doesn't solve the consolidation and the disparity, I think, in cost and coverages that we see, between what Medicare would pay. And of course, the argument is Medicare doesn't pay enough, but I don't know that Medicare not paying enough justifies that I'm going to charge an employer 3 or 4 or 500 times what Medicare is paying. All right, the math just doesn't math for me. All right, I think that it sets up a situation where, and I had one, and it breaks my heart. And I had an employer, and it was looking down the throat of a $200,000 fine, non-compliance for not providing qualified care for his company. $200,000, and I go, that's a lot of money. $200,000, and we looked at his current plan. We looked at our plan, which was way cheaper. We were about 40% cheaper than what he was currently paying. We looked at what the coverage would cost if he was to cover all of his employees or if they all opted into the coverage in one way or the other. And I'm sitting there with his accountant and his CPA. And at the end of a 6-hour meeting, the CPA went, defines cheaper. That's a heck of a statement. Cost of care is so expensive that paying fine to the IRS $200,000 is cheaper than attempting to provide base level compliant coverage for the employees. So literally everyone loses. The employer loses paying a fine to the government in excess of taxes and everything else they're already paying for, right? So nobody benefits from that. I don't know where that money goes. Who wins on that? Where'd that money go? Right? The employees lose because now they have no coverage at all. And then if they go to the ACA for coverage, we're right back to the first part of this podcast. Is that coverage even going to be affordable? Even if they had a subsidy, would it be affordable if they actually had to use it? It ended up having a deductible and copay and coinsurance and all those other things. Or are we just begging to bankrupt the people that make the lowest scale of salary in our economy? So I think this is an important subject. I think it's a subject that needs, people and businesses to kind of close the ranks and say, kind of enough is enough. We live in America. I'm all about capitalism. It's sometimes enough is enough, and we ought to be able to demand from our medical industrial complex fair and transparent rates, regardless of our employment status or age. Because as I said, if I'm 65 and on Medicare and the cost of a surgery is $7,000, and I'm 64 and employed and the cost of the same surgery at the same hospital with the same surgeon in the same place is $50,000, that's robbery. You can say it's robbery. There's no other way to say it. All right? And there has to be a reckoning between those two extremes. I'm not saying Medicare prices and reimbursements shouldn't go up, because I think doctors and hospitals should earn fair wages and have opportunities for fair profits. But if a grocery store's, we scream about grocery prices, and I know that their profit margin is 1 to 3%. Tiny. Why is a hospital's 15? There is opportunities for improvement. And I think we need to start engaging in our medical systems and care the same way that we engage in every other commerce in our life. And the difference is, we know we have to eat. We know we have to put gas in our car. And ultimately, all of us are going to need health care. And there should be a way to engage in that, with, in a thoughtful way that's fair regardless of where you are in your age or your economic situation.
I wish I had a super happy podcast today, but the more I look at this, the more frustrated I get. And I know that we have a lot of solutions over here at Ovation. I know we can help, but I also know that we've got to pierce the cabals and the veil of those things and engage with employers so we can do things in a smart way. And there's a whole lot of people, doctors included, that are on board in this movement and doing it. And right now we're small but mighty, but we need to be larger and more demanding. That's all I got for today, for today's podcast. Join us again for the next Puzzle Healthcare. Hopefully we'll have something a little bit more fun and entertaining.